An independent review of the Personal Independence Payment Assessment. Overview of findings. Number 1. The current Personal Independence Payment (PIP) process gives a disjointed experience for claimants. Some short-term improvements are needed, for example, to communications, including decision letters. In the longer term, there should be a more integrated, digitally enabled claims process under common branding that would improve claimant experience and effectiveness. Two, the way in which further evidence is collected can be clarified and improved. PIP is an assessment of functional impact, yet it is widely perceived as a medical. Health professionals, other than general practitioners, GPs, are often well placed to provide relevant further evidence. The potential for sharing information already held by the department and across the wider public sector should be explored. Three, it is too early to draw definitive conclusions about the overall effectiveness of the PIP assessment based on available published data. A rigorous evaluation strategy that will enable regular assessments of the fairness and consistency of award outcomes should be put in place, with priority given to the effectiveness of the assessment for people with a mental health condition or learning disability. Planning for the introduction of PIP. 4. PIP retains some key features of Disability Living Allowance, DLA. Like DLA, PIP is not means-tested, is non-taxable and non-contributory. Is intended to provide financial support for disabled people with the greatest challenges to remaining independent. Is payable both to those in work and out of work, and has two components, daily living and mobility, with different levels of award for each based on the assessed level of need. 5. PIP was planned in the context of fiscal austerity and followed a 30% increase in DLA caseload over the previous 20 years. Intended shifts from DLA were a move to a more transparent and objective assessment of need, with assessments by health professionals employed by contracted providers. A stronger emphasis on assessment of the functional impact of claimants' underlying disabling and medical conditions, not the conditions themselves. A points-based system to assess eligibility for awards. More regular reviews of eligibility for those receiving awards. And a greater focus on the needs of claimants with mental health conditions. Six, the assessment criteria are central to the PIP assessment and were subject to lengthy consultation and testing. There are 10 daily living activities and 2 for mobility, with points-based scales for functional impact. This review has focused on whether they are being appropriately applied. Early stages of PIP. 7. The early implementation of PIP from April 2013 has focused on new claims and more recently a smaller proportion of natural reassessments for DLA recipients. Managed reassessment for the majority of DLA recipients is scheduled to begin from October 2015. This will be the most challenging phase, with long-term recipients of DLA invited to claim PIP. Assessments and decisions for the early claims have taken longer than expected, resulting in very long delays for many claimants. 8. Addressing these delays through increased resourcing and other measures has been the main focus during 2014. Revised arrangements to fast-track claims under special rules for terminally ill people are working well. The recovery programme for other claims, the great majority, remains underway, and the government plans to publish data on clearance and waiting times from March 2015. (9) The latest published data on PIP awards at the time of publishing this report were to July 2014, when 106,400 were in payment. Some 55% of new claims have received an award. This is higher than originally expected. The Office for Budget Responsibility is now projecting a higher success rate for new claims than the original forecast. Around 75% of existing DLA claimants are expected to receive a PIP award. This information is from Personal Independence Payment Reassessment and Impacts, Department for Work and Pensions, December 2012, Table 2. This information is available at (10) Data so far available is insufficient to draw meaningful conclusions about the composition of PIP awards. Views expressed during the review. 11. The formal call for evidence had a high response, particularly from people who had claimed PIP or supported claimants. The overriding theme, also reflected in other inputs to the review, was the impact of delays and backlogs, with a particular frustration from claimants about knowing the status of their claim and how long they would need to wait. Delays in receiving awards have had an impact on claimants' financial position, including the knock-on to passported benefits linked to PIP. Another strong theme from all groups was concern over the quality of decision award letters. 12. Other main areas where comments were received from claimants and their representatives were the complexity of and time taken to complete the PIP2 claim form, mixed experiences of the actual face-to-face assessment, including a lack of transparency, difficulties with appointment logistics, and views that the impact of fluctuating conditions and mental health conditions may not be being appropriately addressed. 13. In addition, inputs received from DWP staff, assessment providers, and others highlighted constraints posed by different IT and associated systems. Some positive feedback from health professionals about involvement in PIP assessments, but some concerns about the degree of engagement with case managers, a view shared by DWP staff. Areas of dissatisfaction with the arrangements for collecting further evidence, and concerns about the number of appointments lost through non-attendance by claimants. Review findings. 14. The review also visited operational sites and held discussions with staff, observed face-to-face PIP assessments, held focus group discussions with claimants, and met with representative bodies, professional bodies, and a regional tribunal judge. (15) The issues arising have been analysed under three main themes: the nature of the claimant journey, the way in which further evidence is collected, and the overall effectiveness of the PIP assessment. The claimant journey. The claimant journey during the early implementation of PIP has been characterised for many by the impact of delays and backlogs. The resulting progress chasing calls have been time-consuming and frustrating for claimants and costly for the department and assessment providers. While steps to resolve delays and backlogs are clearly necessary, they are not of themselves sufficient, and there are other underlying issues to address. Claimants currently experience a disjointed PIP process and have to navigate the joins between the different organisations involved. There is no need for major change in the delivery model in the short term, but there are areas where early improvements should be made and existing intent reinforced to enhance the claimant experience. These include communications, more proactive use of outbound communications with claimants, and clearer communications about what to expect throughout the process could help enhance the customer experience. Decision letters. The current format of decision letters is unclear and confusing, and the quality variable. They should start with a clear statement of the decision, followed by the award and payment details, a simpler explanation for the reasons and next steps. Training and guidance material on decision letter writing skills should also be strengthened. Strengthening the relationship between case managers and health professionals. There have been some examples of bringing the two together, either via co-location or ad hoc liaison groups, with positive reported results in terms of mutual understanding and better relationships. These approaches should be adopted across the board. Room configuration. It is good practice in clinical assessments for those being assessed to sit at 90 degrees or beside the health or social care professional. This is not consistent practice for PIP, and assessment rooms should be reconfigured. There is confusion about the rationale for reviewing awards known as interventions. And how the policy intent is currently being applied, with unclear communications to claimants. Some aspects of the disjointed claimant experience will take longer to address and will require an evolutionary approach. The longer-term aim should be to have a more integrated, digitally enabled process. An intelligent online system with better links to relevant information about claimants could support a more tailored service. The department should develop its future operating model for PIP along these lines. This will require more integrated IT systems. The earliest possible introduction of a facility for claimants to track the status of their claim, possibly an online portal, should be explored. End-to-end case management should be strengthened, together with a common integrated brand for the overall process. Obtaining further evidence. Obtaining sufficient, relevant further evidence to support effective assessments and doing it at the right point in the process is highly desirable. The current degree of success in so doing is variable. There is lack of clarity about responsibility for gathering evidence and how best to obtain it. A review of external communications could help ensure messages are consistent and provide clarity. There is also considerable scope in the longer term, if PIP is digitally enabled, for more effective collection of evidence at the early stages of the process. The department has started to look at the scope for drawing on relevant information it already holds for people who have had a work capability assessment, a WCA. Maximum use should be made in future of this and other relevant departmental information. Subject to appropriate data protection protocols, the potential for wider sharing of relevant assessment information held elsewhere in the public sector should also be explored. For example, health and social care reports. There is a tension between the claimant's view of GPs as their most trusted source of reliable evidence and GPs' own view that they are often less well placed than other professionals to comment on functional impact. PIP is widely perceived as a medical process rather than as an assessment of functional impact. Much of the terminology reinforces this perception, as do features of the face-to-face assessment. Effectiveness of the assessment. There is wide recognition that the assessment criteria reflect a relevant range of daily living and mobility activities. The review has not sought to revisit these definitions, which resulted from thorough development and consultation. The two areas where there have been questions raised about the application of the criteria are Activity 11 and the treatment of aids and appliances in the daily living activities. The consistent application of these should be monitored by the department. The assessment process should explore reliability as to whether activities can be undertaken safely, to an acceptable standard, and repeatedly, and recognise that conditions and impact can often fluctuate over time. While the review saw examples of good practice in these regards, respondents expressed concern over whether they were being applied appropriately. It is too early to draw definitive conclusions about the effectiveness of the PIP assessment based on available published data. Little has been done thus far to design a comprehensive evaluation strategy that will be reported publicly, and this should be remedied. It should be underpinned with comprehensive management information and research capability. The evaluation needs to build confidence that award outcomes are fair and consistent. Some concerns have been expressed about the challenges for claimants with mental health conditions and learning disabilities in navigating the assessment process. This may have an impact on whether claimants in these groups are receiving appropriate outcomes from assessments and awards. There is no hard evidence available to test this, so the evaluation strategy should include a priority focus on the effectiveness of the assessment for these groups. Current assurance and audit arrangements are focused on judgments reached in individual assessments, vertical scrutiny. This needs to be complemented by looking at the fairness and consistency of outcomes across cases with similar impacts in different areas, horizontal scrutiny. Recommendations. 16. The recommendations from the review have been grouped by the 3 themes and considered in terms of the appropriate implementation timescale. Short-term actions that should be completed, alongside those to address delays and backlogs before the start of managed reassessment. The actions are focused on measures to increase assurance that PIP delivers the design principles and achieves the policy intent within the current model, whilst also delivering some improvements in claimant experience. Medium-term actions to improve evaluation of the accuracy and consistency of award outcomes, and to improve the collection of further evidence. These should be in place from the start of managed reassessment, and longer-term actions to redesign the PIP delivery model, both in terms of claimant experience and business effectiveness, probably implemented in phases. This should be planned before the start of managed reassessment. Improving the claimant experience. The department should, in the short term, 1. Revise external communications with claimants so that they understand what to expect at the assessment and to reinforce claimant rights and responsibilities. Page 49, paragraph 19. 2a. Redesign the structure and content of decision letters, and b. Review case manager training and guidance to strengthen decision letter writing skills and make sure quality checks take place. Page 50, paragraph 22. 3. Take action to begin a sustained programme to build better working relationships between case managers and health professionals. Page 52, paragraph 30. 4. Ensure assessment provider assessment rooms are configured so that the assessor and the claimant sit at a 90-degree angle. Page 48, paragraph 14. In the medium term, 5. Maximise the use of more proactive communications with claimants throughout the claims process. For example, greater use of outbound SMS messages. Page 47, paragraph 11. 6. Ensure that the policy intent for award review arrangements is being met and that guidance reflects this. And that decision letters provide a clear explanation of the rationale for review timings in individual cases. Not using the language of interventions. Page 51, paragraph 24. In the longer term, 7. Review the PIP claims process, adopting a design that maximises the opportunities presented by greater use of digital and other technologies and can be implemented in a phased and progressive way which A. Gives high priority to the introduction of a mechanism, such as an online portal, that allows claimants to track the status of their claim. B. Moves away from a one-size-fits-all model for the claims process and supports a more tailored approach based on the needs of claimants. C. Uses contact with the claimant to identify what information and evidence may already be available to support the claim. D. Makes the claimant journey more integrated under common branding. Page 53, paragraph 38. Further evidence. The Department should, in the short term, 8. For the face-to-face assessment, reinforce existing guidance for health professionals to ensure consistency in how they introduce themselves and the functional nature of the assessment, and limit the emphasis placed on collecting clinical information. Page 58, paragraph 25. In the medium term, 9. Explore opportunities for improving the collection of further evidence by A. Reviewing external communications so that messages about further evidence are consistent and give greater clarity about the type of evidence required and who is responsible for gathering the information. B. Where appropriate and relevant, sharing information and evidence from a work capability assessment or other sources of information held by the Department. C. Examining the potential for wider sharing of information and evidence across assessments carried out in other parts of the public sector, for example, health and social care reports, page 56, paragraph 15. The effectiveness of the assessment. The Department should, in the short term, 10. Monitor the application of Activity 11, Planning and Following Journeys, and ensure there is a clear explanation of the purpose of the activity for departmental staff, health professionals and claimants. Page 60, paragraph 9. 11. Review how aids and appliances are taken into account in PIP assessments against original policy intent and make any necessary adjustments to guidance and training. Page 61, paragraph 12. 12. Ensure the consistent application of existing guidance for health professionals on reliability and fluctuating conditions. Page 62, paragraph 16. In the medium term, 13, put in place and announce a rigorous quantitative and qualitative evaluation strategy with a scheduled plan for the publication of findings, which includes a priority focus on the effectiveness of PIP assessments for people with a mental health condition or learning disability. Page 63, paragraph 22. 14. Provide assurance of fair and consistent PIP award outcomes by supplementing existing vertical quality assurance with the assessment of horizontal consistency. Page 64, paragraph 25.